And the state surgeon general used this metaphor to justify it.
The Florida Department of Health, in partnership with the governor, is going to be working to end all vaccine mandates in Florida law. All of them. Every last one of them. Every last one of them is wrong and drips with disdain and slavery.
Hey guys, welcome to My Brother's Ballot. I'm your boy Poe Theory. Don't forget to comment, like, and subscribe. It really helps the channel grow. So let's get into this foolishness. So apparently Florida, and it's always Florida, wants to remove all vaccine mandates for children. So that means measles, that means the mumps, that means hepatitis, that means pertussis. But of course, it's Florida. So as we know, Abby Phillips did have a panel. Of course, you know, we had the MAGA stooge, Scott Jennings, and Ben. I can't even think of Ben's last name, but at this point, I think Ben actually may be worse than Scott. Let's get into this clip.
Is Dr. Chris Purnell. She's the director of the NAACP Center for Health Equity and Public Health and Preventative Medicine physician. And Dr. Purnell, you know this well. In 2020, we had 13 cases of measles. 2025, 1,400. A huge increase in whooping cough in this country. And at the same time, the rates of vaccine exemptions have gone up by about a point since 2019. None of this is by accident. None of this is by osmosis.
Do you guys hear that? How small of the amount of cases we had in 2020 to now it's 1,400 cases now? We don't see a causation here. This is MAHA, Make America Healthy Again.
And now this in Florida.
Reckless. If I could sum it up in one word, let's just go to some facts. And I have them here to keep myself honest. Since the last 30 years, we've saved over 150 million lives because of vaccines globally. If we begin to think about in the United States, we've saved over 1.1 million children due to vaccinations since 1994. We've prevented 508 million illnesses and 32 million hospitalizations. That's not anything to wink at. That's hardcore data. But what's happening in the United States is as if we are a runaway train. In public health, we talk about the cliff of good health, and we have fallen completely off of the cliff.
That's kind of what it feels like in a way, Ben, that everybody sitting at this table, all the folks in Florida, all of these people who are vaccine skeptics now have benefited from vaccines allowing them to live their lives without polio, without measles. And now all of a sudden they want to pull the rug out from underneath children. I'm surprised by it. I mean, you have kids, a lot of us do at this table. If you lived in Florida, what would you be thinking?
Two things. One, they're not outlawed. That's good. The parents are going to decide. Two, there's a cause and effect, and the CDC lied to us about COVID, and they lied a lot. They lied about masks in school.
Not true.
They lied about distancing. They lied about the efficiency.
I would like to highlight when he says that the CDC lied, the CDC did not intentionally give you misinformation. With science, the more you learn and the more experimental data that you receive, a lot of times previous findings will then be proven incorrect because now they have more information. Now they have more data. To call it a lie is a bridge too far, especially when it comes to public health.
The effectiveness of the COVID-19 vaccine.
Not true.
It is true. They said that distancing.
The
Hold on, wait. Did they not lie about the effectiveness of a mask when internal documents
if you
said
talk about
that the
certain
mask
types
did not
of
work in the
masks,
schools?
if we're looking at high quality masks, right? So P95 masks,
I would love it if they would've said that.
masks
They
actually
didn't say
prevent
that.
infections. Because look,
didn't
this is
say
the
that.
way science works.
Science
Works that as you get
finish and answer the
data, the
question she
type
was
of
asking.
communication that you give
This
improves.
is
But
why
you can't say the
American-
CDC
I
Florida's
the
doing
reason
right now.
You can't
Hold
say
on,
the
I think
CDC
I actually think it's important.
It's
for
very
her-
important.
If
If you're saying
No,
things that are
they're doing it
not
because of malpractice,
accurate,
political
I do think it's
bullshit.
fair for her to
the
counter that.
CDC said that masking was effective and worked when they knew internal documents said.
It
And the
does
emails came out
work.
that it didn't work.
Okay, well, what
True or
she
false?
does.
Okay,
6
well,
foot distancing.
hold on a
True or false?
second.
The CDC
Hold-
say
hold
that
on a
6
second.
Misinformation,
foot
folks.
worked, and it
You're
didn't.
seeing it in
You-
action.
first of all,
They said it was going to stop the spread in 2
Misinformation.
Ben, are you
weeks.
gonna
You're
are you gonna
seeing
are
it
you
in
gonna have a
action.
conversation, or are you just gonna keep talking? Look, hold on. Okay. First of all, what she is disputing is your language around this, which is that they lied.
Yes, exactly.
Which she's saying, and I think she's right about this, is not true.
Exactly. And again, I would like to highlight, he's a political pundit. She's an actual doctor. This is what she went to school for. And again, you have someone like Ben trying to shout her down about actual science and how science works. The Trump administration is full of people that said that America has went away from meritocracy. But this is the type of people that they put in office. These are the type of people that they have speaking on their behalf. Just a whole bunch of mediocre men.
There are certain types of masks that work better than others.
We've been
A,
using masks
and
for
B,
decades.
the whole point of
emails-
science. I mean, and this is,
Abby,
I think
this
that-
is
let me
why
just-
Florida did this. And
let
this
me
is
just
what you
bring-
guys don't understand.
hold on.
No, Florida
There's a
did it
cause and
because of
effect. The
political
American people don't trust the
one-upsmanship.
Hold on a
That's why
second.
Florida did
for
it.
the reasons I said. You may not like that. You may not
Because
like the
of
American people.
political
believe
Americans
that.
don't trust the
figures
CDC
They do not.
because people like
data.
RFK Jr. and
Thank
others.
you.
That's why
Actually, this
RFK
guy-
Jr. got the job he's got
this
now
guy-
because
he
so many
got the
people
job
didn't
because of
trust the
Hold on a
reckless
second. Okay, Ben, just give me
leadership.
1 second, okay? This Florida Surgeon General has been railing against vaccines for a while, but he's also responsible for a lot of misinformation. He's altered key findings in a COVID-19 vaccine safety study.
Malpractice.
He pushed things like cures like ivermectin and others for
Wait, hold on.
COVID.
Did
Reckless.
ivermectin not work? You
No,
have data that shows that it did work.
no.
Oh my God, I cannot believe we're going back to this. It does not work. There have been plenty of studies to show that that is not an applicable cure or a treatment for COVID.
all of those
Conclusive
other
data that it does not work
That's-
effectively.
that is
Okay, Ben, are you really going to argue with the doctor?
Thank
at the table
you.
about this?
This is
With a
hold
doctor
on,
who
this
is
is-
helping to save
when we
lives
all
in
listen
a
to
safety
doctors
net
during COVID,
institution,
you guys
when-
screwed us
when-
and we
when
failed
when
miserably.
we
You lied about a
listen-
Let me
vaccine.
move on
when we
because
listen to-
hold on 1 second. I just want to move on because
Did we lose more people per capita than any industrialized Western nation because doctors lied, or because of who was in office saying that it wasn't a big deal and it would be over in a couple weeks and that you don't need to wear a mask? The same person that actually did something right by Operation Warp Speed, but then refuses to say anything positive about it because his base is so anti-vax. Like, are we serious here?
I just want to play this because I think people forget sometimes where the president at the time was Donald J. Trump. And this is what he said about vaccines at the time. His own vaccine, by the way, that he helped develop.
You tell parents about getting their kids vaccinated. Measles. I'm the measles. Measles. Tell parents about vaccinations. They have to get the shot. The vaccinations are so important. This is really going around now. They have to get their shots.
So that on measles, Trump in 2019 was get your measles vaccine. Operation Warp Speed, some people say he should be nominated for the Nobel Peace Prize. Fair argument to make. But now all of a sudden, this is about being lied to when people did not know a whole lot about COVID at the time.
Let's take a big picture view. The COVID vaccine ended up being a miracle drug.
It did.
There is no doubt about that. You can say that certain people later on in terms of booster shots should or shouldn't have gotten this, young men, you can make all those. The bottom line is it was a miracle drug, period. We have to start from that perspective. Then you talk about other vaccines, right? We're not just talking about COVID. And COVID's an excuse to basically say, well, we can't listen to anything. They're all lying to us. All these vaccines are bad. No, they're not. They've been proven year after year, decade after decade, putting aside COVID for a minute.
I would also like to highlight, I just always find it so funny that especially the demographic of people that are railing against vaccines, there tend to be an intersection with them being, racist. And these are the same people that would say that there is no systemic racism and that Black people just need to pull themselves up by their bootstraps. If you look at the history of what the medical industrial complex has done to Black Americans, when you go to the Tuskegee experiment with modern female medicine and when it comes to birth control and things like that, how they literally sterilized so many Puerto Rican women. Sometimes I struggle with knowing the history and just calling these people that are anti-vax, kooks or whatever the case may be, especially when you know the history of the medical industrial complex and its effects on minorities and its populations. But the loudest anti-vax folks out here today, they would say that those type of things don't exist. And so it's just so hard to even give them any type of leeway for the discussion that they're trying to have, because it just comes off conspiratorial and political.
That the rest of these vaccines work. So the fundamental question becomes, do you view this through the prism of I, or do you do this through the prism of we? Exactly. If you view it through the prism of I understand the point, which is, why should I be forced to get something that I may not want to get? I get it.
It had side effects.
I hear
like
it.
Heart issues.
But look, there are medical exceptions. But there are medical exceptions in Florida where if you have a medical condition right now, you don't have to get those vaccines. If you have a medical exception, the point is, if you view it as a we, as a community, we did that. There was a failure.
So listen,
But that's the part that you're missing about the American people. Measles has been a failure.
No. I'm going back to COVID-19.
Well, I know that it's convenient to go back to COVID, but we're
that's where this started.
No, it didn't.
No, it didn't.
Hold on, Ben.
COVID-19.
Right now, in this, hold on, Ben. Right now in this country, Scott, the question is, should children going back to school? You also have kids. Mm-hmm. I don't know if
I would like to highlight, when Scott doesn't agree with something on the right, you will notice Scott is extremely quiet and he lets his other right-winger friend take all the heat. He says nothing. And Abby always makes the point to say, well, Scott, what do you think? Because Scott can't defend this.
they're vaccinated or not, I presume they probably are. If they are going back to school, should they have a vaccine for polio? Should they have a vaccine for measles, mumps, and rubella? Should they have a vaccine for any number of things
for chickenpox
that we don't even talk about anymore because it's not really a part of American life because we've eradicated it because of vaccines? Should they?
Yeah, I think it's indisputable that vaccines have saved millions upon millions of lives, and that these vaccines for these diseases you're talking about work. I mean, they've been working for decades in many cases. So yes. I think that's fact number one. I think Dan raised an interesting point about you could hold two thoughts at the same time. You could believe that they work and believe that you don't have any questions about it. And you may also believe that the government shouldn't make you do anything that you don't want to do regarding health care.
Government makes you get a license.
Whether you have concerns about the vaccines or not, there are people who do not believe that the government should be able to
government makes you wear a seatbelt.
Anything like that. Well, there are people that don't think that.
They don't make you drive.
And so,
make you drive.
Yeah, I think it's possible for people to hold. So anyway, I think that's kind of the debate that's going on.
The government
personal.
I'm sorry, there should be no debate when it comes to actual vaccines. I think sometimes we get so far away from how horrible or how bad shit used to be in this country that some people just need a reminder, because this anti-vax thing coming out in the way that it did when we have decades and decades of data to show why vaccines are extremely important blows my brain. It's very similar to the racism conversation. Oh, because Black people aren't in chains anymore, then we've come a long way. Why do you keep talking about racism? No, you have to continue to talk about these things so that way we never make sure that we go back. And people need to be taught these things. So when certain things are popping up that are reminiscent of that, we are able to call it out and name it. There's no reason we should be debating vaccines right now. And let's be very clear. If you are one of those people that feels like you don't want the country to be able to tell you what to do with your body, then you, just how Ben was saying, the government doesn't force you to drive. Okay, well then you are not allowed to be in public life, endangering other people's health.
The two things that are really troubling in this whole debate is the fact that we do have to collectively make a certain level of sacrifice, and getting vaccinations are part of that sacrifice with a glorious outcome for the majority with a few exceptions. And to see the the president, the leaders in Florida play political games of vaccinations, to see people cheer this on, not really understanding the full impact of what this is going to do for political expediency. And the second point, very irrational, irresponsible for him to compare people having to get vaccinations with chattel slavery. There are no other atrocities.
I was hoping and praying that someone was going to bring it up, and I'm sure you guys saw in the beginning of the clip, in the beginning of this video, when he said it was just like slavery. That is why I kept bringing up race throughout this video, because for that black man to get on camera, and I'm not going to assume that he knows his history or the lineage of black Americans when it comes to chattel slavery, but to equate having to take a vaccine to slavery is mind-blowing.
They would never make that comparison when it comes to the Holocaust, but you want to make that comparison when it comes to chattel slavery. It is reprehensible that he would do that, or anybody would do that, that cavalier nature. And all it continues to do is amp up the animus in this country for reasons
Can we talk about Florida specifically just for a minute? So in Florida, approximately 88% of kindergartners have their full and complete vaccination. That is already below the recommended amount if you're going to achieve herd immunity. If you take away the vaccine mandates, you're going to see that number plummet. When that number plummets, not only are households going to be infected and potentially get sick, but the most vulnerable people in those households, and those are children. Without mandates, we are not going to adequately protect our children. And we've already seen, no, let me finish. That's not bullying. We've already seen evidence.
This country has no issue with bullying just about any other demographic, but for some reason we got a couple white anti-vaxxers down in Florida, and now all of a sudden, like, oh no, they're being bullied. No, it's for the betterment of this country. Your freedoms cannot encroach on anyone else's freedoms. I don't think that they truly understand that. And I hope people are listening and watching what they are saying when it comes to this conversation. This is not, they're rounding up illegal immigrants. So there's some cognitive dissonance because, you are a white American and they're not going to round me up because I'm not brown. I'm not black. But diseases don't see color. They come after everyone.
When we don't protect children, children are left susceptible to irrational decisions of adults. We have children in the United States dead from measles. That should not happen in 2025.
Ben, how do you with a straight face?
It should not.
Seriously, how do you with a straight face can anyone justify, even if you don't like the COVID vaccine, saying that because you don't like the COVID vaccine, you should open up the Pandora's box
to everything
of diseases that we have put on the back burner of public life. So why would one thing even remotely justify the other?
When you have the CDC that does not have the trust of the American people, and clearly in Florida, they do not trust the CDC with their children.
This has nothing to do with the CDC.
Yes.
This has to do with Florida public health.
You can lecture the American people all you want to, but I'm trying to explain to you why parents are saying, I don't trust.
I know that you are trying to justify it, but
I'm fine. It is explaining
this is actually
why
not about.
People, by the way, if you don't like this Florida, you can move.
This is not about the parents at this point.
Sure it is.
This is about
absolutely about the parents having the right to choose.
Did you hear what this man just said? If you don't like the policy of Florida, then you can move. Okay. Well, for the right wingers that are so afraid of what's happening in DC, y'all should move, leave. They don't want you there. If you don't like Zoran Mamdani possibly being the New York mayor, leave. Go to Florida and get the measles or mumps.
This is about the state. This is about the policymakers.
You must vaccinate your children.
Ben, this is about the policymakers. This is about the governor. It's about the Surgeon General.
So why is it so popular?
Why
is it so
are they willing to sacrifice the health of millions of children because they don't like the COVID-19 vaccine?
You guys won't even admit that we got it wrong with COVID at this table.
Are you so sure that
we have
parents still
not
get
gotten
their
it
children
wrong?
vaccinated? Even without
we have not gotten it.
Hold on a second.
I think you're raising an interesting question about the numbers. You said millions of children. Are you so sure that parents won't get their children vaccinated without
They
a
want the
mandate?
I think
choice.
that,
I mean, the mandate.
I think
we
it's-
already
it
have
is-
I mean, they
data
could
on
still
that.
get them vaccinated.
She
We already have data
addressed
on
that.
But not
Yeah,
enough.
not
Yeah.
enough. We
But
already
if you
have
want to
data
blame
on
somebody
that.
for this,
know how
blame the
many people
CDC
won't.
for losing
No,
the trust of the American people.
Okay, you're wrong again. Okay?
No, I'm not.
You're
We're having
loud
this
and wrong.
conversation because
You're
the
loud
American
and wrong.
people don't
Let's
trust
talk
the
about
CDC.
political actors who started to spew intentionally.
Dr. Chris T. Purnell, she is on it. And I've seen a couple comments from people saying like, oh my God, she wouldn't let anybody talk. She shouldn't. When someone is saying the things that he's saying that is extremely dangerous to public health, when she is an expert and she understands what will happen when talking points and people like him become pervasive in our community, in our country, that's extremely dangerous. She should continue to throw her credentials on the table and show that she's an expert and how she is the actual one, instead of worrying about people's I just feel like they lied to me. You are not an expert. How do you get out of here? She is.
Because the CDC misled and lied to the American people during
which
a
has led
shutdown
to
of the world.
confusion, has led to chaos, and has led to an unnecessary loss of
Again,
life.
then you
Do
should talk to
you
the
know
CDC. You
why
should
we
talk
were
to the
able to
CDC.
save
Don't
the
be
lives
mad
that
at
we
me.
did? Because
Be
public
angry
health
with the
divisions,
scientists that lied to the
CDC,
American
see that
people.
Could we
that's what's
take the
dangerous.
CDC
Be angry with
out
the
of
science.
this?
Yes,
We
why?
wouldn't be having the conversation
Why?
No,
about
but
that.
what I'm
just the
saying is that
CDC?
if we just kind of think through this, I mean, I think we all pretty much agree that
This
the
conversation would
vaccines-
never be happening.
But I'm
if it
saying,
wasn't
okay,
for the lies of
but
COVID-19.
there's a way to talk people through the differences of what happened during the COVID pandemic
Sure.
and the global
And that's where doctors come in.
and the global impact. Well, we got
But
our
I'll be honest, the arrogance of doctors is not going to get.
That's where the doctors come in. Meanwhile, he's literally over talking a doctor and making it seem like he's the expert.
To come to your
It's not
side.
about the
You're
arrogance
yelling
of
at parents
doctors. You
who are
are
skeptical of
yelling
the CDC.
about.
He just said, and it's not going to help with the arrogance of a doctor. Are you serious? Doctors should be arrogant when it comes to something that they have spent hundreds of thousands of dollars for, as far as their education and how much time they have spent researching and understanding the human body and how vaccines interact with the human bodies. They should be the ones speaking predominantly on this topic. What Again, the hubris of a mediocre white man.
You're diagnosing the problem, but you're not offering a solution. The solution
Don't lie to parents.
The solution to this is not take away the vaccine mandates. The solution is to reassure parents
Literacy.
about the safety and efficacy of vaccines, which
Education.
are really not in question. But rather than doing that, policymakers are not doing that. And I think that is, nobody is disputing that.
Then here's
They
what I
are
would
not
say.
doing.
And we're going to stop it right there. And I think Abby made a really good point. Instead of trying to restore the trust in the CDC and trying to restore the trust while RFK Jr. is in charge is crazy, but whatever. Instead of curating and creating these programs to restore the trust in our vaccinations, to give people the information, we just say, you know what, we're going to just take away the mandates. You don't have to get vaccinations. Are we dumb? Well, that's the question that we already know the answer to. So anywho, guys, I hope you enjoyed this video. Please don't forget to comment, like, and subscribe. Peace.